Hi, this is Dr. Hardaway. I wanted to discuss what we do when we perform an abdominoplasty or a tummy tuck procedure. This is an example of a normal abdomen with the rectus abdominis muscle. This white line down the center represents the fascia, which is a strong tissue between the muscle and on top of the muscle. During pregnancy, the fascia stretches. And there can be various areas on the abdomen where the fascia stretches. It's not a hernia, it's just stretching of tissue, and this tissue is called fascia. So in the top example, the stretching is mainly above the belly button. So this means that the abdomen protrudes more above the belly button than below. In this next diagram, the stretching is mainly below the belly button. So in this case, the upper portion of the abdomen will be flatter than the lower portion. Now, sometimes it could be right in the center, as shown in this diagram. So in this case, the abdomen protrudes more in the center than above or below. And then on some patients, the fascia can stretch all the way down. So that means the entire abdomen protrudes. Now, this could vary with the weight gain of the patient, the size of the baby, how quickly the weight was gained. So there's various options that can contribute to the types of diastasis. So what's done, we make a low incision. We lift the skin and the fat off the muscle. We are not inside the abdomen. And that diastasis is repaired all the way down. The xiphoid is sort of like the end of the sternum, and we repair the muscle all the way down to the pubic area. I do not lift the skin off the ribs at all. It's more like a triangle, and this skin is actually removed. Now, I do liposuction the sides to give more of a contour. Now, this is an example of what's done during a tummy tuck on one of my patients. So a low incision is made, and this incision is in the normal groin crease. The rectus abdominis muscle runs vertically. The diastasis is that strong tissue called fascia that's between the muscle and on top of the muscle. And this is what stretches during pregnancy. So the skin and the fatty tissue is lifted off the muscle. So we're not inside the abdomen. This is a skin muscle operation. And then this muscle is tightened all the way down. That's what makes the abdomen flat. And then I contour the sides with liposuction just to give more of a contour. So when you look at this post-op photograph on the right, this skin that's above the belly button is now down here. All of this skin has been removed. And then the sides are contoured. And that's how you get a nice hourglass during a tummy tuck procedure. Now let's look at some other examples. Okay, here's an example of a patient. The incision is made low. Here's a rectus muscle. and this is the fascia. So we lift the skin and the fat off the muscle, and we tighten the muscle all the way down. And this skin is removed. So that means that the skin that's here ends up down here. And then the sides are contoured with liposuction. And that's how you get like a nice hourglass. Now, when you look at this patient's side view, you see that the majority of the stretching was here in the center. There's also some stretching below also, but by tightening the muscle all the way down, you see the patient is much flatter and has a better contour post-operatively.